All right, hello everyone. So let's talk about how to carry out the abdominal exam. And like our previous videos, we would be using the script-wise approach. And like in all of the conversations, remember wiper plus IPPA. The interesting thing about the abdominal examination is similar to the cardiovascular examination. That's probably one of the examinations where you get to do all of the IPPA. Now, with that said, I'll tax you to go back to my previous videos and remember what wiper means and IPPA. With that said, the script for this examination is hands, eyes, armpit, mouth, lymph nodes, and then the abdomen itself. Now, what do you do in the hands? Like I've said in the previous video, the fact here we're trying to give you a script so that you can do the OSCEs. So in the hands, it's similar to what I've covered in the cardiovascular exam. So you want to inspect the hand, you want to inspect that way, and that way you want to check the pulse, you want to check for a liver flap and things like that. And once you've checked the hands, you want to check the eyes for things like pallor, jaundice. You want to examine the armpit for loss of hair, and then you want to examine the mouth for pallor and changes as well. Once you've done that, you want to examine the supraclavicular node precisely for vercous nodes, because that's associated with intra-abdominal malignancy. If you've done that, you want to now get to the abdominal examination properly. And for the abdominal exam, you want to follow the full IPPA steps. The abdomen, you need to divide into 9 regions. In one of my anatomy videos, I'm going to cover the surface anatomy of dividing the abdomen into 9 regions. Then you want to carry out superficial palpation. But before doing that, you want to ask the patient if there's any part of the abdomen that is painful, and that part is examined last. Just as this, in some examinations of the abdomen, it's ultra focused. It tends to be at postgraduate level, so the examiners may be interested in you, for instance, examining for the gallbladder for things like cholecystitis, demonstrating that, so Murphy's signs and the rest, or the appendix for the signs related to appendicitis. So you have Swartz signs, Roughson signs, and all of that, but we won't go to that detail. So superficial palpation, you want to do the 9 regions of the abdomen sequentially. So you want to go from one end like that to the other end. If there's a tender part, you want to do that last. Then you want to do deep palpation for organomegaly. So you want to merge your palpation with the patient breathing in. And so you want to palpate for the liver, you want to palpate for the the spleen, and you want to ballot for the kidneys. Once you've done these, oftentimes you want to check for ascites using shifting dullness or some other technique like fluid trill if the ascites is big enough. With that said, some of the abdominal exam, you want to palpate for the abdominal aorta. Now, once you've palpated, you move to percussion in 9 regions as well. So once you percuss in 9 regions, also trying to demonstrate 9 regions as well as demonstrating shifting dullness, which I've talked about. Then you get to auscultation for bowel sounds, typically in the right iliac region, because that's where you have the ileocecal valve, and it's easy to pick vowel sounds there. The traditional teaching is you listen to for vowel sounds for a minute. Usually you hear 3 to 5 vowel sounds over the course of 1 minute. And in some books you would hear that you could listen for renal artery stenosis. And so you can listen for renal artery stenosis just about 2 cm lateral and above the umbilicus, 2 to 4 cm lateral and above the umbilicus if there is. After this, usually you need to offer to also examine the hernia orifices. So the typical ones in an adult would be the inguinal hernia orifices, the femoral hernia orifices. That would be the commonest one. There are others, but not usually required for undergraduate level. With that said, you want to offer to do a digital rectal examination and examination of other systems as you deem fit. So in summary, to recap, you'd go through wiper IPPA, and the script is hands, eyes, armpit, mouth, lymph nodes, and the abdomen properly. And the abdomen, you go through inspection, palpation, percussion and auscultation, and all the tests. You think of hernia orifices, digital rectal examination, and any other system that you think there could be pathology. Then, of course, you summarize your finding and present to the examiner. Thank you for listening. Like and continue to subscribe to the channel. Thank you. Bye.